there is a patient who has just fallen down. Okay, so I am in a out of hospital scenario where I need to resuscitate this patient. Okay, so in an out of hospital scenario, first I'll see the responsiveness and then I'll activate the emergency response team. Okay, we can do both the things parallel, or if say Mr. X is with me, if you can just come over here. Supposedly the patient has just fallen down, okay, and I tell him what you do is you just call 911 and activate the emergency response team. In the meanwhile, I'll check why he has fallen down. Okay. Now, when I check the responsiveness, the first thing that I tell you, are you okay? Are you okay? Twice I have checked. In less than 10 seconds, I need to check whether the patient is breathing or not. I'll just have a tangential look towards the chest of the patient to see if the patient is breathing or not. Okay. Then synchronously, like together, I need to go put my 3 fingers in the center of the trachea and then just glide it down and feel whether the carotid pulse is present or not. Okay. Now, in the first setting that could happen is the patient is breathing and the pulse is present. So, since he has already activated the emergency response team, I'll just wait for the emergency response team to come and take the patient for further care. First scenario that can happen. The second scenario that can happen is the patient is not breathing, but the pulse is present. When I have checked, okay, the patient has not responded, he is activating the emergency response team, the patient is not breathing, but when I have checked the pulse is there. So, I need not to start the chest compressions, but yes, I need to give him breaths. First option, manual breath, mouth to mouth. Maybe prohibitive for some of you. You can use your hand, or if you find a device, anything like this. Okay, you can use a pen, maybe you can use, just take out the refill of a pen and you can use. Because in normal setting, we breathe on 21% oxygen in the atmosphere and we exhale 17% oxygen. Okay. So, I'll just place in the mouth, and there are 3 maneuvers that are explained in BLS. One is head tilt. So, you have to tilt the head up, okay, and you have to give a jaw thrust. Jaw thrust has to be given from this part, you will give a jaw thrust and then chin lift. So, head tilt, jaw thrust, chin lift. Take a deep breath, push it in, okay. So, what is this? This is head tilt, jaw thrust, chin lift. 3 maneuvers, head tilt, jaw thrust, chin lift. 3 maneuvers we have done. Then I have given only the breath. The third scenario that can occur is that the patient, when I have checked for responsiveness, the patient is not breathing. When I have checked for the pulse is not present. Okay? I have activated the emergency response team. आपने phone कर दिया 911 को? Okay, phone कर दिया 911 को, and then he has already activated the emergency response team. And what I'll do is I'll start the chest compressions. I'll just target the lower half of the sternum or the breastbone. I'll interlace my fingers like this, and then I will start the compressions. Compressions, how you should start and how you should do. You have to stand straight here. Your elbows should be locked, and then you should start the compressions using your body weight. But do not lean on the patient. You mind it, do not lean on the patient, because there has to be adequate recoil of the heart. Okay. So, this is very important. Okay. So, now I have started the compressions. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 15, 16, 17, 18, 19, 20, and so I'll give 30 compressions. Okay. Meanwhile, he has already activated the emergency response team, and the emergency response team has just arrived, and they have brought this automated external defibrillator. They have brought this automated external defibrillator. This is the AED machine which you will find everywhere. Okay, it's available on metro stations, it's available at airports, it's available at malls. Okay, what you should do is whenever the AED arrives, first thing that you should do when the AED arrives is switch on the button of the AED. Okay, this is again a question you will encounter subsequently. And then just as you hear to your mother and father's orders, you should order to him. You should listen to him.
Exactly as shown.
What is he telling? To apply the pads. Okay.
Bare skin.
So these are the pads, as you can see. Okay. This is the
When the first pad is in place, peel the second pad. Place pad exactly as shown.
so I place the
Firmly to bare skin.
okay. So this I have placed on the just below the collarbone, and this I have placed at the
One
apex.
point. Stay clear of patient. Analyzing heart rhythm.
Okay. I am standing clear of the patient means don't touch the patient.
Stay clear of patient.
Stay clear of the patient.
Analyzing heart rhythm.
Analyzing heart rhythm.
Stay clear of patient.
Stay clear. All clear.
Flashing orange button now.
So
Deliver shock now.
it is asking me
Shock delivered.
shock delivered. Once the shock is delivered, you should start the chest compressions instantly, as I described. Okay. So you should
CPR. Press the flashing blue button.
see. So you have to start the chest compressions at 100 to 120, the depth of at least 5 to 6 centimeters, and compression is to ventilation ratio of 30:2. So by the time my AED has come, probably
45 seconds until analysis will resume.
I'll ask him, okay, you come on the compression part, I will ventilate the patient. Okay. Ventilation, as I told you, just a minute. Ventilation, as I told you, you have to tilt the head like this. You have to give jaw thrust, chin lift. Okay. And start the compressions. I'll give 2 breaths and then tell him to start the compressions. He has started the compressions. Count.
1 minute, 15 seconds until analysis will resume.
Okay, count. ठीक है. Fine. 30 compressions are over. Once 30 compressions are over, 2 breaths. 30:2. Okay. Again he will start. Okay, fine. Wait.
Until analysis will resume.
So we have to follow the orders what the automated external defibrillator is telling us continuously. It analyzes the rhythm. Every 2 minutes the chest compression part the person will change every 2 minutes.
Until analysis will resume.
Okay. So it will wait for 2 minutes and then analyze the rhythm yet again. Okay. So this is the use of the automated external defibrillator, and treat it as God when it's in front of you and when the patient is dying.
Until analysis will resume.
Okay. Because it will deliver shock in VF and pulseless VT. It will not deliver shock and tell you to resume CPR in all cases of cardiac arrest and asystole and pulseless electrical activity.
Until analysis will resume.
Okay, see, everything is being directed by that, and once you will continue, and once the ambulance arrives, the patient gets shifted to the ambulance. That will be called advanced resuscitation or for post cardiac arrest care and recovery. Okay. So this is the rhythm that we used to follow. Okay. So this is the practical aspect of what we just discussed in the theory, and this is line by line in